Once I finish in the English, then I will tell you in a Hindi. So don't worry if you can't understand in English. Okay, let me finish first in English. एक बार हमारा ये पूरा लेक्चर खत्म हो जाए फिर हम पूरा हिंदी में रिपीट कर देंगे, चिंता मत करिए अगर किसी को समझने में प्रॉब्लम आ रही है तो एक बार मैं इंग्लिश में पूरा एक्सप्लेन कर देता हूँ. So today our topic is battlefield acupuncture. This acupuncture system is very famous. Acupuncture system. We are using just 5 points for any pain. Either this is the pain of knee joint, back pain, ankle joint pain, heel pain, lower back pain, middle back pain, upper back pain, any pain in the body, we are using just 5 points. As we can see, the name of this system is Battlefield. Name itself tells us everything. This system has been discovered for the warriors who is going in the battlefield. Sometimes it becomes very difficult to carry lots of medicines. Sometimes even medicine are unavailable. Then people are suffering with lots of pain in the joints. It may be the pain of the degeneration, like happening because of the aging, old age, and it may be the pain of injury, accident. Whatever the reason is, either this is the pain of injury, accident, acute pain, or it is chronic pain because of some degeneration, drying, decreasing synovial fluids from the joints. Whatever the reason is this, we can use this system. So this is so wonderful system. The name of this system is Battlefield Acupuncture. One minute. So when we talk about the ear, so whenever we talk about the ear, in here we are having lots of points. In ear we are having more than 200 points. And in ear, our body is just like a fetus in the mother womb. So our body just like that. So head down and feet up position. So this is the ear, and the ear we have our position of body in that way. So head is down and all the body parts is upward. So we can say if we want to see the body in the ear, so let's see this image. In this image, we have presented slightly that you can see in this image very clearly. This is the spine, this is the lower spine, this is the legs, this is the lower leg, this is the feet. So we can see feet is going up. So if you go down, that is the head region. If you go up, 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 that is the middle spine, lower spine, and some legs is up. So what I want to tell you, in the ear, we have inverted spine, we have head down and feet up position in the ear. So considering this representation, we have lots of points in the ear, more than 200 points, but we are not, no need of learn, no need to learn all the 200 points for treating any pain. Just with the help of 5 points, we can treat any types of pain, only 5 points. So let's discuss that 5 point. The first point is cingulate gyrus. What is cingulate gyrus? What is cingulate gyrus? The cingulate gyrus is the part of brain. And when we talk about the brain, we have master brain. Then we have emotional brain. Master brain is called cerebrum. And emotional brain is called limbic system. So when we see our human brain, look at in this image. So we can see this is a human brain. This look like say walnut. You can see the upper part, which we can see very clearly. It is the master brain or cerebrum, which is very easily visible here. We can see here. If we go inside, if we go inside of this brain, so first we can see this is the master brain. All part is the master brain. So if we remove the skin, then we can find out lots of bones here. These are all our bone, frontal bone, parietal bone, and all. If we go inside, then we can see this is brain looking like a walnut. And if we remove this master brain, then this start emotional brain. After removing the master brain, then this start emotional brain, or we tell it limbic brain, limbic brain. So the outer covering is a master brain, and the middle covering is limbic brain or emotional brain. So we can see after removing the master brain, we can see limbic brain. And this is the part which we can see clearly. This is the part of emotional brain. The name of this part is cingulate gyrus. So cingulate gyrus is the part of our emotional brain and which is responsible to feel the emotions of sadness, of joy, of crying, of worry, all the emotions, as well as cingulate gyrus also feel the pain. So when we see if cingulate gyrus is not good, maybe some person is little depressed, unhappy, he may have some pain in the body, in the shoulder joint pain, in the hip joint pain. So first point will be cingulate gyrus. So as soon as we put the cingulate gyrus, we are balancing the person emotionally. So this is our first step in the battlefield acupuncture. So the first step, just we have to put the point of cingulate gyrus. So we can see in another image, like see, this is the master brain or uppermost part of the brain. And if we remove this master brain, then we can say what is visible now? That is emotional brain. So this upper part is a master brain. This whole upper part is a master brain or cerebrum. And if we go inside, so this is the emotional brain or limbic system. In this limbic system, in this limbic system, at this level, we find the cingulate gyrus. So let's see in the other image. So this is the master brain. We are removing upper part of the brain. So this is the cingulate gyrus. We can see it is written here. This is the cingulate gyrus or the part of emotional brain. And this is so effective. As soon as we put this point in the ear, immediately this relieves the pain. So now how to search this point in the ear, where it is situated. So let's see the image of ear. So if we look at the image of ear, so this is the cingulate gyrus point or first painkiller point. We can see here, this is the lowermost point. This one. This is the cingulate gyrus. Then how to locate this point? This is the main questions. So if we just think as a layman, we don't know anything. We think as a layman. Then this is the vertical part of the ear coming down, 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 down. And this is the horizontal part of the ear. And we can see here, this is bifurcation. So this cingulate gyrus just fine, just available on the bifurcation of vertical line and horizontal line. We will also see in other images. So look at in this image now. Yeah. So look at this image. We can see the cingulate gyrus here. I will rotate the ear so you can understand the exact location of the cingulate gyrus. So look at this position. So this is the on the junction of vertical and horizontal line. So this is the exact point, cingulate gyrus. Very easy to find out, just on the junction point where this vertical line crossing and becoming a horizontal line. So we can see this is curve. The name of this curve is IT, means intertragic notch. IT. So those who learn acupuncture, auricular acupuncture, they know the name of this notch is IT. means cingulate gyrus. So finding out the cingulate gyrus is very much important task. Sorry, 1 minute. So look at here. I think now it is not difficult to understand the location of cingulate gyrus. You can see from all the images, and not only for the pain. If you see someone is not balanced emotionally, then just by a single point, you can treat him emotionally. So you can see this is just on the junction. So this is the location of cingulate gyrus. Very wonderful point and painkiller point. So what we do in the battlefield acupuncture, we put the cingulate gyrus in the right ear. Whatever the pain, whatever the problem, we don't bother. Patient is telling knee pain, cingulate gyrus. Back pain, cingulate gyrus. Heel pain, cingulate gyrus. Headache, migraine, middle back pain, upper back pain, this pain, that pain, chronic pain, acute pain, injury pain, whatever the reason, either this is acute or this is chronic, the first point will be cingulate gyrus. Then we will ask the patient, okay, move the painful part. So suppose patient is telling, I have knee pain. Then we put the cingulate gyrus point. Even it doesn't matter. We start from the right ear or left ear. This is our choice. Suppose I started from the right ear. Patient told me, doctor, I have right knee pain. And I started from the right ear. Then I asked the patient, okay, move the knee. How are you feeling? Walk for a while. Then I will wait 30 seconds. Because as per the battlefield acupuncture, we should wait for 1 minute, but it becomes very difficult to wait for 1 minute. So sometimes we wait only 15 to 20 seconds only practically because we have total 5 points. Then patient will tell you, doctor, I'm not feeling anything. I'm not feeling any improvement. My pain is same like earlier. Oh, okay. Then we will put the same point in the other ear. Like if I started from the right ear, then I will put the same point in the left ear. Then I will repeat the same process, same procedure. Okay, now move your affected part. You have knee pain, so move the knee. Walk for a while. Walk here and there and see if there is any changes. Patient tell, no doctor, I don't have any change. My pain is same like earlier. So first point completed in the both ear. And remember that we have started this treatment from the right ear. So whenever we start, we will start from the right. And even we can start from the left ear. Then whenever we will start, during all the 5 points, we will always start from the left. So this was the completion of first point. Then, now we will proceed to the next point. Because patient is telling, doctor, I don't have any change. My pain is same like earlier. It is still bad. It is still paining. Do something. Then what to do? Then we will proceed for the next point. That is Thalamus. So now we are moving to the next point. That point card thalamus. So look at in this image now. So this is our next point, thalamus. Second painkiller point, and this is not an ordinary point. Thalamus is the great painkiller. Whenever we have any pain, either because of injury or because of emotion, thalamus also responsible to feel that pain. And if you want to see the location of thalamus in our body, so just come back to the nervous system. So we can see this is your master brain like walnut. So when we tell someone, oh, you are very intelligent, that time just we are praising this walnut or master brain or master or cerebrum. So as soon as you remove the cerebrum, the outermost part, then this is the emotional brain or cingulate gyrus, the part of the limbic system, the part of the emotional brain. Now, if we go down, so we can see this is the thalamus. See, this is the thalamus. So thalamus is the hidden inside, very at the very deeper core of the brain, or we can understand the nucleus of the brain, the center of the brain, that is thalamus. So this part is called thalamus. We know, we have heard many times, hypothalamus. If we go down to the thalamus, so that is the hypothalamus. That is the different separate structure. And hypothalamus is also very important part of the brain. But in our battlefield acupuncture, we are just focusing on the thalamus because thalamus is the great painkiller point. Or also we can understand this thing. Thalamus is the connector of master brain and emotional brain. So it is the connecting unit. So whatever happening in the emotional body, what is happening in the, what is master brain? Master brain is connected with the, like, our memory, our thinking, our intelligence, whatever you are seeing, whatever you are hearing, whatever you are feeling, all the sensation, that all because of the master brain. And emotional brain, what we feel emotionally. And thalamus is the unit who connect both. So that's why the person who is having balance on the emotions and the person who is doing any work with a synchronization of master brain and emotional brain, then action will be perfect. We cannot move ahead just by the brain, or we cannot move ahead just by the emotions. So thalamus is the unit who is connecting both the units together. And we are doing all the work with good synchronization. And thalamus is a great painkiller point of our body. So as soon as we put this thalamus point, there are great reactions happen in the brain, and it not only reduce the pain, but it also give the message to the hypothalamus for healing. So just not think that we are doing this 5-point protocol only for the pain killing, just it is like a painkiller tablets. No, this 5-point protocol is good for pain killing as well as we are starting healing. So when we are going in our ear, so we can see here, this is the point of thalamus. What? This point is not where we see. This point is just opposite to that, means hidden side. So how to go there and how to see the exact location of this thalamus? So before proceeding, I would like to tell you, in our ear, we have body like a fetus in the mother womb. So this is the brain. This is the brain. This is the spine. This is the legs. This is the chest cavity. This is the abdominal cavity. So in this way, in our ear, we have whole body. So my focus right now is just telling to you that where is the brain? This is the brain. So if this is the brain, then we find the point thalamus just on the back side. So let's look exact location of the thalamus. If this is the brain, so we found thalamus here. So I will show you the exact location of the point thalamus. And now, many person are doing putting little wrongly this thalamus point, so not achieving good results. So thalamus point is very effective and we should put it very correctly. If you are putting correctly, then you will achieve the results. So let's see here the exact location of thalamus. See, from this image right now, we can't see where is thalamus point. Just it is written thalamus, but where is it? Where is the point? Where is it available? Now we go inside. So look at, this is the inside. This is the exact location of thalamus point. If you put outside, which I shown you in the previous image, then you will not achieve results. So this is the exact location of thalamus inside. Look at this. So how to put the thalamus point? For putting the right in the right with thalamus point, you have to do one thing. Feel this brain like a mountain. So this is the tip of mountain. We can say this is the tip of mountain. And jump from the mountain and go down, 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 reach on the bottom. So at the bottom level, then that is the location of thalamus point. But remember one thing very clearly. This point is on the wall. Please do not put point in this inner place. This point is not in this inner cavity. This thalamus point is just available in this bottom of this wall. So the name of this wall is concha wall because this cavity, inner cavity is called concha. So this is called concha wall. So this is the exact location of thalamus point, which is the great painkiller point. Practically, I have seen in many patients, as soon as we put the thalamus point, we achieve the results. Look at here. Look at here. Now again. So this is the location of thalamus point. And this is the just at the mid of the brain. So thalamus point is the point who not only reduce the pain but also reduce the swelling and balance us emotionally, because it is the unit which found between cerebrum and emotional brain. So now look at here in this image. So if this is the whole brain, you just search the midpoint. And at this midpoint, you have to go on the back side, hidden side, on the bottom of the back side. That is the exact location of thalamus point. So, but in this image, we have shown in the front side. And we have made the triangle, the meaning of triangle, that we have to go on the back side. This is the second point. So now, first we have started our treatment with the cingulate gyrus. And we put the cingulate gyrus in the right ear. And we ask the patient, how are you feeling your knee? He told, doctor, I don't have any change. Then we put the same point in the other ear, in the left ear. No change. Every time we have to wait minimum 30 seconds because body may take some time to bring the effect. Then we are moving to the, again, same ear, right ear. Then the question is this, how much down we have to go? Like suppose you have some ball and you are holding a rope in your hand and you are going down, 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 and you reached at the earth. So on that level, at the most bottom, then but you have to put point on the wall only. Please do not put on the bottom wall only. So you have to come down as much as possible. That is the thalamus point. So we have put the one point, cingulate gyrus in the right ear, same in the left ear. Then we have put this thalamus point in the right ear. Asked any change? No change. Then same point we put in the left ear. Again we ask any change? No change. We have completed 2 points, but still our patient is telling, doctor, I am still feeling pain. I don't have any change in my pain. My knee pain is still there, like earlier. Then we'll proceed to the next point. That is omega 2. In our ear, we have omega 1, omega 2, omega 3, multiple points in that way. So omega 1, this is omega 2. We also have omega 3. We also have omega 1. Omega 1, omega 2, sorry, omega 3, omega 2. So omega 2 is a painkiller point. Omega 3 work on the digestive functions and omega 1 work on the brain. Omega 1 in this lower area. I don't want to tell you anything about the omega 1 and omega 3 Just I want to tell you, omega 1 is good for brain, 3 good for digestion. But right now we are talking about the omega 2, which is painkiller point. And where it is available? So look at here. In this image, so first we are folding our ear, like simply. We are folding our ear and we are reaching on the apex of the ear because it is very easy to find out the topmost part of the ear. How to find out this part? Just fold your ear, then search the ear apex. And that ear apex has been considered as an allergy point. So from this ear apex, if you jump medially, that is omega 2 point. So from the ear apex, if you go 1 centimeter medially, that is omega 2 point. Omega 2 point has been considered as a great painkiller point, especially for the rheumatoid arthritis. Omega 2 has been considered as a very good painkiller point when someone is having lots of undigested food in the bloodstream and that undigested food flowing in the blood. When your digestion is not good, you are having lots of gas, acidity, indigestion. And that undigested food flowing in the body, that time, this omega 2 is very useful.